Hey everyone, and welcome back. Today we're going to be taking a deep dive into the world of BS healthcare management in Pakistan.
Cool.
We've got a pretty interesting mix of sources for this one. Two university websites
Oh, wow.
and a blog post.
So it's like the official info, but then also like an insider's perspective.
Yeah, exactly. I thought it'd be good to kind of get, the structured side of things
Yeah.
and then also that personal experience.
Definitely. Yeah. Having those different perspectives, I think, is always helpful.
Yeah, totally. So our mission today is to really give you guys like a solid understanding of what this degree is all about, where it can take you career-wise, and what makes it unique in Pakistan.
Sounds good.
So let's just kick things off with like the most basic question.
Okay.
What exactly is a BS in healthcare management?
So basically, it's all about taking those core like business skills that you learn, finance, strategy, operations, all that good stuff,
Right.
but applying them specifically within the healthcare system. So instead of like managing, a regular company, you're managing a hospital or a clinic or even like a whole network of healthcare facilities.
Oh, okay. So like almost like the CEO of a healthcare operation.
Yeah. Yeah, you could think of it like that.
That's pretty cool.
Ah.
But why is this degree so relevant in Pakistan right now?
Well, Pakistan's healthcare system is facing a lot of challenges right now, growing population,
Yeah.
increasing awareness of health issues, and just this huge desire for better healthcare overall.
Right.
So all of that means that there's like a massive need for skilled professionals
I see.
who can really step up and manage these healthcare organizations effectively.
So it's not just doctors and nurses that are needed.
Right.
It's also the people behind the scenes, making sure everything runs smoothly.
Yeah, exactly. It takes a whole team.
Totally.
Yeah.
And you mentioned a whole network of healthcare facilities. Does that mean that this degree, is it just focused on hospitals? Or is there more to it than that?
Oh, there's definitely more to it than just hospitals. You'd be surprised how much variety there is in this field.
Really?
So this degree covers things like managing, smaller primary healthcare units, which are super important in Pakistan.
Okay.
How to integrate like new software and technology into healthcare systems.
Interesting.
And even navigating the whole world of e-healthcare, which is like rapidly growing right now.
Wow. I had no idea it was that broad.
Yeah, it's a pretty diverse field.
Okay. I'm already seeing how this degree could open up like a ton of doors career-wise. But let's get into like the fun stuff now.
Okay.
Specializations.
Ooh, yeah.
I know there's a bunch of options within healthcare management. So let's just focus on a few that sound super intriguing to me, at least.
I like that because then we can see how this information actually applies, to your individual goals. And
Totally. Okay, so first up, healthcare law and policy.
Interesting.
This one, to me, sounds perfect for someone who wants to understand the big picture of healthcare. You know how laws and regulations directly impact how healthcare is delivered in Pakistan?
Yeah, absolutely.
Like that whole side of things.
That's a really interesting area because it could lead to, roles in government agencies or advocacy groups or even like consulting for healthcare organizations.
Oh, wow.
It's all about like understanding the rules of the game and then using that knowledge to like make a difference.
Yeah, that's super cool.
Yeah.
All right, next we have patient advocate.
Okay.
Now, this one to me is like the one that tugs at your heartstrings a little bit.
Yeah.
It's where you're directly working to help patients navigate the system and making sure their needs are met.
Right. And that's crucial, especially with how complex Pakistan's healthcare system can be. You need someone who has that empathy and those communication skills and can really advocate for those patients' rights within a really complicated system.
Yeah, for sure. Okay, last one for now. Healthcare informatics.
Yeah.
Getting some strong tech vibes from this one.
Yeah, you're right on the money. Healthcare informatics is all about using technology to improve healthcare delivery.
Oh,
So think data management, electronic medical records, telehealth, all of that.
Wow. So if you're into tech and you have a passion for healthcare, that could be a cool path.
Yeah, definitely a growing field for sure.
Okay, hold on. I need to pause for a second.
Sure.
One thing that surprised me when I was reading these sources is that a BS in healthcare management doesn't automatically mean you're stuck working in a hospital.
You are correct.
Really?
That is a misconception that we need to debunk right away.
Okay, good, because I was like, wait a minute. There's got to be more to it than that.
There is.
Okay, give me some examples. I'm hooked.
Okay, so you could go into education,
Okay.
training future healthcare professionals.
Got it.
Which is super important with the growing demand.
Right.
You could work in research or, analyzing data, contributing to new discoveries that improve healthcare.
Interesting.
NGOs are another big area.
Oh, yeah.
Especially those focused on public health initiatives in Pakistan.
That makes sense.
They often desperately need people with those management skills.
Oh, for sure. Wait, hold up. You can even work for pharmaceutical companies.
Yep, absolutely.
Really?
So managing clinical trials, marketing new medications, analyzing market trends, all of that.
Wow.
The skills you learn in healthcare management are really valuable to the pharmaceutical industry.
Mind officially blown. Okay, let's shift gears a bit and talk about the actual curriculum.
Okay.
Now, instead of, listing every single course, which I think could get really dry,
Yeah.
let's focus on a few that really capture what this degree is all about.
Love that. Let's make this info stick.
All right, so healthcare economics, for example, sounds like a crash course in how money actually works in the healthcare system.
It is. It's a vital one.
Right.
Imagine understanding healthcare financing, different insurance models, cost effectiveness.
Mm-hmm.
You'll even learn about how Pakistan's unique insurance system impacts healthcare costs.
Oh, wow.
That's something you wouldn't necessarily get in just like a general business degree.
Right.
So that knowledge is gold.
Yeah, for sure. Next up, healthcare ethics and law. I'm sensing some pretty tough decisions in this one.
You're not wrong.
Okay.
Healthcare throws you a lot of curveballs ethically,
Yeah.
from patient confidentiality to end-of-life care.
Right.
This course really dives deep into how to navigate those situations ethically, especially within, the legal framework of Pakistan.
Yeah.
One of the sources even mentioned that you'll learn about how cultural and religious beliefs in Pakistan can impact those healthcare decisions.
Oh, wow. That's really interesting.
Super interesting stuff.
Okay, gotta admit, I'm intrigued. And finally, for a taste of that CEO life.
Okay.
How about strategic management?
Yes, the big leagues.
Yeah.
So this is where you learn to analyze the healthcare landscape as a whole, set goals, create action plans, and ultimately make those strategic decisions that impact the entire organization.
Like big picture stuff.
Yeah, big picture thinking, high-level choices.
That's awesome.
Yeah.
All right, now let's talk about what makes this degree unique in Pakistan. We know their healthcare system faces some pretty specific challenges, right?
Absolutely. And that's what makes studying this in Pakistan so valuable.
Right.
You're not just learning general healthcare management principles. You're learning how to apply them in a context that's directly relevant to your future career.
Yeah, that makes a lot of sense. Our sources mentioned a few universities that offer this program. The University of Faisalabad,
Okay.
Lahore, University of Biological and Applied Sciences, and IBA Karachi.
Yeah, and what's interesting is that each of those universities probably has its own unique curriculum, faculty expertise,
Right.
even different fee structures.
Oh, for sure.
So you really need to do your homework,
Yeah.
find the program that best aligns with, your goals and your budget.
Totally. All right, let's wrap up this section by focusing on, skills for success.
Okay.
We know this degree teaches you all about managing healthcare. But what about those skills that you can use in AMY career? Like those transferable skills?
Great point. This degree goes way beyond just healthcare knowledge.
Okay.
It sharpens your critical thinking skills, the ability to analyze information and make those smart, calculated decisions.
Right.
That applies to anything.
Yeah, for sure. And let's not forget about communication.
Oh, huge.
Being able to communicate clearly and effectively with patients, colleagues, stakeholders.
Yeah.
That's essential in any leadership position.
Absolutely. Whether you're in healthcare or any other field.
Totally.
Yeah.
Those communication skills are like gold.
They're invaluable.
Yeah. They make you adaptable and open up so many possibilities.
For sure.
So even if you're not 100% set on a healthcare career just yet,
Right.
this degree could still be a fantastic investment in your future.
Exactly. It gives you those specialized skills within healthcare, but also equips you with those broader skills that employers are always looking for.
Yeah.
It's a win-win.
Totally.
One thing that kind of jumps out at me from these sources is how much they emphasize real-world experience.
Yeah.
It's not enough to just learn about it from a textbook.
Mm-hmm.
You got to actually get out there and apply that knowledge.
Oh, you mean like internships?
Exactly.
I always wondered how important those really are.
Yeah, well, it seems like these programs really get that.
Yeah.
You need to see healthcare management in action to really understand it.
That makes sense.
Yeah.
So what kind of hands-on experiences are we talking about here?
Well, the blog post mentioned like internships at hospitals and clinics.
Okay, yeah, that's what I would expect.
Yeah, but it also talked about the possibility of interning at like government health
Oh,
agencies.
wow.
Imagine getting to like shadow a healthcare administrator,
Yeah,
see how they make decisions, maybe even contribute to projects
that would be amazing.
that are like making a real impact.
You'd be learning from people who are already out there doing the work, building your network,
Yeah,
getting a taste of what your future career could actually look like.
exactly.
Yeah.
And it's not just about picking up those like practical skills. It's also about developing those soft skills.
Soft skills. What do you mean by that?
Things like communication, teamwork, problem solving, adaptability.
Gotcha.
All those skills that you can't really teach in a classroom,
Mm-hmm.
but are like super crucial for working effectively in any team,
Right.
especially in a fast-paced environment like healthcare.
So even if you're not like directly managing a team during your internship,
Right.
you're still developing those interpersonal skills that
Okay.
will make you a more effective leader down the road.
Exactly. And let's not forget about the importance of cultural competency.
Oh, yeah, that's a good point. Especially in Pakistan's healthcare landscape,
Absolutely.
there are so many different cultural and linguistic groups.
Mm-hmm.
You know, healthcare professionals need to be sensitive to those differences.
For sure. An internship, especially one at like a public hospital or clinic,
Okay.
could provide incredible exposure to that diversity.
Right.
Firsthand experience interacting with patients from different backgrounds, which would help them develop that cultural competency.
For sure. Okay. I want to shift gears for a second and talk about the bigger picture.
Okay.
We've covered a lot about this degree.
Yeah.
But why should someone actually care about pursuing a career in healthcare management?
Right. Like, what's the big draw?
Yeah, convince me.
Okay. Well, I think there are a few really compelling reasons.
Okay.
I'm all ears.
First and foremost, it's about making a real difference in people's lives.
Okay.
Healthcare is a fundamental human right.
Mm-hmm.
And as a healthcare manager, you're directly involved in making sure people have access to quality care
Right.
when they need it most.
I can see how that would be really rewarding,
Yeah,
knowing that your work is contributing to something so essential.
for sure. It's more than just a job at that point.
Totally. And beyond that, it sounds like a challenging and intellectually stimulating field.
Oh, absolutely. Healthcare is constantly changing.
Right.
New technologies, policies, challenges popping up all the time.
So you need to be able to think critically, adapt to change quickly, and like find creative solutions to complex problems.
It definitely doesn't sound like you'd be bored in this career.
No, not at all.
You're constantly learning and figuring out how to improve the system.
Exactly. And of course, let's not forget about the career prospects.
Right.
The healthcare industry is only getting bigger, which means the demand for skilled professionals, especially those with a management expertise,
Yeah.
it's going to keep rising.
So it's not just about making a difference. It's also about having a stable and rewarding career path.
Exactly. You hit the nail on the head.
Okay. You've officially sold me on the why.
Yeah.
Now, for someone listening who's thinking, this sounds amazing,
Sure.
but where do I even start?
Okay.
What are the next steps they should take?
Well, the first step is always research.
Okay.
Like really take a deep dive into those universities we talked about earlier.
Mm.
TUF Lahore, University of Biological and Applied Sciences, IBA Karachi.
Yep.
Explore their websites, see what their specific programs offer. Check out the admission requirements.
Right.
You might even want to reach out to like current students or alumni.
Oh, that's a great idea.
Get their perspective on the program.
Yeah, there's nothing like hearing from people who've actually gone through it.
Exactly. And while you're at it, don't be shy about exploring financial aid options.
Okay.
Scholarships, grants, even part-time work opportunities.
Yeah.
All of that can make this kind of education more accessible.
So finances shouldn't be a barrier.
Right.
There are resources out there to help you make this happen.
Exactly. And as you're doing all this research, start thinking about your own strengths and interests.
Okay.
Like, what are you most passionate about within the world of healthcare?
Yeah.
Are you drawn to the clinical side, the policy side, the tech side?
Right.
Figuring out what truly excites you.
Mhm.
That'll help you choose the specialization and the career path that best aligns with your goals.
I love that. And remember, this is a marathon, not a sprint.
Right.
Be patient with yourself. Ask tons of questions. And don't be afraid to reach out to people in the field for guidance.
Yeah, those connections are so valuable.
Totally. It's all about taking those baby steps and building momentum towards your ultimate goal.
You know, as we're talking about this, it's actually really inspiring to think about the impact that graduates of this program could have.
On Pakistan's healthcare system.
Yeah.
I know, right? With their management skills, their healthcare knowledge, and that cultural competency, they could really be the ones driving innovative solutions
Absolutely.
for some of the biggest healthcare challenges facing the country.
Imagine them improving access to care in rural areas.
Yeah.
Setting up telehealth programs to reach those remote populations.
Well, that's a good one.
Developing new strategies to tackle those chronic diseases.
They could be the bridge between policy and practice.
Right.
Making sure healthcare policies are actually being implemented effectively on the ground.
And we can't forget about their potential to advocate for patients' rights, push for higher healthcare quality, and really champion those ethical practices.
It's honestly exciting to think about the ripple effect their contributions could have on communities across Pakistan.
That's what makes this deep dive so rewarding.
Right.
It's not just about gaining knowledge. It's about sparking inspiration
Yeah.
and empowering you to envision yourself making a real difference.
So if you're listening to this and feeling that spark, don't let it fade away.
Keep it going.
Explore those programs, connect with people who are already doing this work, and take that first step towards a career that is both meaningful and impactful.
You never know. You could be the next healthcare leader who transforms healthcare in Pakistan.
Okay. I love that energy.
Yeah.
But before we get ahead of ourselves, I do have one question that's been nagging at me.
Sure.
We've painted a pretty rosy picture so far.
Yeah.
Are there any downsides or potential challenges that graduates of this program might face?
That's a great question, and it's important to be realistic.
Okay.
One potential challenge is the bureaucracy within Pakistan's healthcare system. Oh, yeah, I can see that.
It can be slow-moving, resistant to change, and sometimes, well, a little bit frustrating to navigate.
So even with all the right skills and knowledge, graduates might run into roadblocks when they're trying to implement new ideas.
Right, and that's where those soft skills we talked about can become even more crucial.
Gotcha.
Things like persistence negotiation and the ability to build relationships and advocate for your ideas effectively.
So it's about being prepared for those hurdles
Yeah.
and finding ways to overcome them.
Exactly.
Yeah.
That makes sense.
Oh.
Are there any other potential challenges?
Yeah. Are there others?
Another potential difficulty is the funding landscape for healthcare in Pakistan.
Okay.
Resources can be limited, especially for innovative projects
Yeah.
or initiatives that haven't been tried before.
So graduates might need to get creative when it comes to securing funding.
Exactly. They might need to explore partnerships with NGOs, international organizations, or even private investors
Oh, interesting.
who are passionate about improving healthcare in Pakistan. So it's about being resourceful
Yeah,
and finding ways to make those ideas a reality, even when funding is tight.
exactly. You got it.
You know, as we're wrapping up this deep dive, it's kind of striking how much this degree seems to emphasize the human side of healthcare.
Yeah, it's not just about, crunching numbers and creating spreadsheets.
Right.
It's about understanding those real needs of patients,
Mm-hmm.
navigating the complexities of the system,
Yeah.
and always considering those ethical implications.
Exactly. We talked about the patient advocate specialization.
Right.
But even in other roles, like you said, healthcare administration or health informatics, you're constantly interacting with people and making choices that impact their lives.
And that requires a certain level of empathy,
Right.
cultural sensitivity, strong communication skills.
Totally.
Those qualities are just as important as the technical stuff.
For sure. I'm curious, though, about how this degree prepares grads to tackle the specific challenges within Pakistan's healthcare system.
Okay.
We know there are issues with access affordability and the overall quality of care.
Right. Well, that's where the curriculum and those real-world experiences come in.
Right.
Students are likely exposed to those challenges through case studies, research projects, and their interactions in those real settings.
So they're not just learning best practices in some theoretical bubble.
Exactly.
They're learning how to apply those principles in a context where resources might be limited, infrastructure might be lacking, cultural factors can heavily influence decisions.
It's about developing that problem-solving mindset, being resourceful, and finding creative solutions that actually work.
And maybe even more importantly, it's about instilling a sense of social responsibility
Absolutely.
in these future healthcare leaders.
Graduates of this program will be equipped to advocate for real change.
Yeah.
Push for policies that improve access and affordability, and challenge the status quo when it comes to quality.
It's about empowering them to be more than just managers.
Right.
They have the potential to become true agents of change within the system.
I love that One of the sources even quoted a prominent Pakistani physician.
Oh, really?
Yeah, and they said, we need a new generation of healthcare leaders who are not only skilled, but also deeply committed to serving the needs of our people.
Wow, those are powerful words. And it brings us back to that thought-provoking question
Okay.
that we wanted to leave our listeners with.
All right, hit me with it.
Considering all these challenges and opportunities, what kind of innovative solutions could graduates of this program pioneer in Pakistan?
Ooh, that's a good one. What if they could leverage technology to create those mobile health clinics that could travel to those remote villages,
That's a great idea.
providing those basic healthcare services to populations that desperately need them?
Or imagine them developing community-based health insurance programs
Oh,
that
interesting.
are designed to meet the needs and financial realities of low-income families.
That would be huge.
And what about using data analytics
Mm.
to pinpoint patterns of disease outbreaks
Yeah.
and then create like targeted prevention programs?
Those are all fantastic examples
Right.
of how graduates could use their skills, their understanding of Pakistan's healthcare system, and their passion to create meaningful change.
It's inspiring to think about all the possibilities.
I know. I hope our listeners are feeling that same sense of excitement and motivation.
Me too.
Yeah.
This deep dive wasn't just about giving information.
Right.
It was about sparking that curiosity and showing you what's possible with the right education and a desire to make a difference.
Absolutely.
So if you're ready to take that leap
Okay.
and explore the world of BS healthcare management in Pakistan, don't wait another second.
You started.
Start researching those programs, connect with people in the field,
Yeah.
and let your curiosity be your guide.
Because the future of healthcare in Pakistan needs those passionate individuals who are ready to step up and lead the way.
So go out there and make it happen.
You got this.
And that's a wrap on our deep dive into BS healthcare management in Pakistan.
Awesome.
We hope you found it insightful, engaging, and maybe even a little inspiring.
Thanks for listening, everyone.
Until next time, keep learning, keep exploring, and keep diving deep into the topics that matter to you.